Forrest General has had an imaging system since 2005, so we've been collecting various documents for patient clinical documentation, patient accounting, those types of things for quite some time. Although we started imaging in 2005, we actually backdated a great number of images in our files from as far back as I believe 1999. So it was quite a challenge when you think about 38 million images across that many years to accommodate that conversion. They were waiting, in some cases, days for their images to appear in the imaging system previously, and now they have real-time access to that data from the point of scanning. They can immediately see those documents where they need to see them. Before, they really only could access the image. If they needed to email it, they had to print it out, scan it to an email, or they had to print it and fax it to someone. So those capabilities have really improved their workflows. We measure dollars in a lot of different ways, and time and resource is definitely one of those areas you can measure it in. So because of those improvements, we're saving money all the way around, not just on the purchase of the product. Because R.J. Young has a local presence, we knew we had local support. If we really needed them, they could be here immediately, and they have been. I mean, they understand document management, they understand how that fits into an organization, whether that be medical or otherwise.